everybody, and welcome to our webinar on reducing chronic absenteeism with ARP HCY funds. I know it's a little later on the East Coast, and so I want to thank you all for making some time to be here with us today. My name is Anna Sophia Treyes. I'm a K-12 Senior Program Manager here at Schoolhouse Connection, and I'm joined by a couple of my colleagues who may pop into the chat or answer some Q&A when we get to that point of the webinar. And of course, we have our lovely panelists here from the Rochester City School District. If you all would like to just say hello in the chat to each other, please feel free to do so. Always love to hear who's in the room with us today. And just a couple of housekeeping things before we get started. Just want to remind folks that this webinar should last about an hour. We do have a Q&A box in your control panel on Zoom, and we ask that if you have any questions throughout the webinar to please send them in, but to send them in the Q&A box. Sometimes they get a little bit lost in the Zoom chat function, so we want to make sure that we see them and can respond to them in a timely fashion. This session is being recorded and it will be posted on our webpage very shortly after this webinar is wrapped up, and you will be receiving a certificate of attendance for participating in today's webinar. We have recently launched a Schoolhouse community on Slack, and this is really a space for you all to connect with each other. So if you do have any questions coming out of today's webinar, it's a really good place to ask questions and see what other folks are doing around chronic absenteeism in their districts. And then just want to do a quick introduction about Schoolhouse Connection for folks who may not be familiar with us. We are a national organization that works to overcome homelessness through education. We provide a variety of information, including information on federal and state policy advocacy. We have a Q&A from our inbox that has all of your questions around the McKinney-Vento Act and any of the rights of students experiencing homelessness. So it's a great resource if you have any questions about that. We also host webinars and we have implementation tools, some of which we will discuss today. And we have a youth leadership and scholarship program where we support our young scholars with not only financial support, but also case management. And I know that we are here to talk about some potential solutions through ARP HCY funds for students who are experiencing chronic absenteeism, but want to just talk about the issue kind of from a greater lens. So we know that in school year 21-22, when we have the most recent data available, 52% of students who experienced homelessness nationally were chronically absent. And it's important to realize that this rate is a 20% increase from pre-pandemic rates of chronic absenteeism. And we also know that this is a 22 percentage points higher than permanently housed students. And so we know that students experiencing homelessness in particular are at an elevated risk to be chronically absent. We also know that there are many barriers for students experiencing homelessness to regular school attendance. So one of those things is high mobility. So we know that when students are moving from different temporary housing situations, it can impact their school attendance. We also know that the inability to meet basic needs, so things like food, clothing, hygiene, and even regular access to cell phones can be a really big barrier for regular attendance, as well as the lack of access to wraparound support. So things like mental health supports or physicals or anything to address their physical needs can also become a really big barrier to regular attendance. And the good news about today is that I'm here to say that we can think about ARP HCY funds as a way to address some of these needs. So the U.S. Department of Education did release a Dear Colleague letter in September 2023 that specifically asked states to expedite funding, including by modifying administrative procedures. We know that we are getting very, very close to those federal deadlines for spending ARP HCY funds. And so we ask that you all please circulate this widely to your superintendents, school business officers, and really any other folks who are involved in spending decisions. We also published a 2-pager that just has an overview of allowable uses, so highly recommend that you look at that if you're looking for some more ideas for how to spend any outstanding funds. And then just a couple more highlights to cover here, which is one of the allowable uses of ARP HCY funds is food assistance when reasonable and necessary and when there are no other funding sources. So as I mentioned a little bit earlier, we know that access to basic needs is really, really crucial in maintaining regular attendance. So that's one way to do that. We also know that ARP HCY funds may be used to support early childhood education. for young children birth through 5 who are not formally enrolled in the LEA but are experiencing homelessness in the LEA. And ARP HCY funds may be used to support college and career readiness and really any other activities to support the smooth transition to higher education. A couple other highlights are that the purchase of vehicles and reimbursing parents and youth for gas costs through prepaid debit card, gas cards, and paying for limited car repairs are another allowable use of ARP HCY funds. We know that transportation piece can be really, really big for students experiencing homelessness and supporting their regular attendance. And motel stays of 3 days or longer when reasonable and necessary are also an allowable use of ARP HCY funds. Again, thinking about that stability piece, it can really help with regular attendance. And we did publish recently a 2-pager that just has some benefits and considerations around making vehicle purchases, if that's something that you're interested in doing in your district. And we just released one around hotel motel stays as well, which is right off the presses. So I highly encourage that you check that out as well. And the last thing for me before I turn it over to our panelists is just want to remind folks that Schoolhouse Connection did do a guest blog with Attendance Works, and we talked specifically around how to use ARP HCY funds to support students experiencing homelessness. So if you have not checked that out, I highly recommend that you do as well. And with that, I'm going to go ahead and stop sharing my screen. And I am going to go ahead and turn it over to our lovely panelist from Rochester City School District. And I'm actually going to let them introduce themselves. So Elizabeth, we can start with you.
Okay, thank you, Ana Sofia. My name is Elizabeth Reyes, and I've been the McKinney-Vento liaison in the Rochester City School District for about 15 years, and we're one of the big 5. And today I have a couple of colleagues. I'll let them introduce themselves.
Hello, good afternoon. My name is Paola Machuca, and I am a social worker in the Rochester City School District, and specifically working under Elizabeth Reyes in the Families in Transition program. And I, myself and my colleague, Ms. Janet Scott, do outreach under McKinney-Vento. So we're the outreach team.
Ms. Janet, I think you're muted.
Thank you. I am Janet Scott, and I am a community liaison specialist, and I worked under Elizabeth in the McKinney-Vento department for almost 2 years.
Yes. Thank you, ladies. Oh,
and I'm in transition, so excuse me if I go in and out because I'm in transition. I'm transporting kids. That's what we're about, right? Helping the babies.
That's right. Thank you, Ms. Janet.
Yes.
Okay, so I'm gonna try and share screen share. Hopefully it'll let me. Just so you have a visual. Am I sharing, Ana Sofia?
Yeah.
Okay, wonderful. Now I have to go to slide. Right? Okay. So we are one of the big 5. I wanted to start with this slide because this is everything that we've been doing ARP. We use a holistic approach. So we believe, helping the parents, helping the siblings, whatever it is, helping the family as a whole is helping. You might have that student that's your identified student, really, that you come in is the presenting student, but helping the family really is and should be part of this work. Building relationships is huge. That's why it's much bigger than the others, because we need to, without building relationships and trust, it's really hard to get kids to come to school. They need that one caring person that they can trust, that will be there with them and help them. Also in our work, we do a lot of repairing harm, addressing their needs. Like you said, Ana Sofia, their basic needs is huge. And often the kids don't get to school when they're hungry or not able to eat or don't have clothes and things like that. Eliminating barriers. A couple of things that with our funds that we've added to our program is definitely creating a village or building community for students. so they know where to go when they need help, and building a bridge for them for resources, because it's not always easy for our kids to navigate the systems and sometimes even the district, right? So in our district, and I just wanted to clarify, because a lot of people are like, oh, you're from New York? And I know you hear this a lot. We're not from the city. We're about 5.5 hours from New York City, but we're an hour away from Niagara Falls. That gives you some context as to where we are. We have about 23,000 students. I looked back at our data in 2021. That is the year I believe we were like half year virtual and then half year in person. And I believe COVID happened March of 2020. So you can see our numbers were greatly impacted. Before that year, we were averaging over 3,000 for like 3 or 4 years in a row. So our numbers were greatly impacted. To date, we're at 2468, which is amazing. It's wonderful. It feels like, you know, definitely our work is evident in the data, and we are finding kids and able to engage them and have them come to school. When I started in this job 15 years ago, it was myself and a 20-hour, I guess you could call them, they were project workers back then. But every year we try to add layers of support and services. So I have 2 social workers this year. And since ARP is funding, I'll be losing one of my social workers. Hola. We have a bilingual homeschool assistant and then a secretary, and that's our staff. And we actually have a physical, like a suite where kids can go to. We're not part of placement or we are part of a department, but we're a standalone office where kids can come and drop in whenever they need to without an appointment. So let me move this out of the way. So as part of our grant kind of like initiatives, we wanted to target, you know, identifying, since our numbers were down, right? We wanted to make sure we found kids. We were identifying them and re-engaging them with school. And both of these would address the non-attendance and then the chronic absenteeism. Like I said, pre-COVID, we identified at least 3,000 or a little bit more. But during COVID, it was bad. Like our numbers were really low. So as we transitioned back in person, we found that we were challenged just like others to those systems we had, those routines and rituals that we had with different departments, with legal, with schools, with the community. We were challenged with people remembering them, with people using them. So what we did was we just really worked hard to re-educate and affirm those practices. We did a lot of training. We did a lot of collaboration, not only with shelters and different service providers, but with students and families as well. But we also needed a creative and resourceful way to do outreach, right? And to find our students. So I think it definitely helps that I've been in the position for 15 years. It helps with background and continuity. And this, I think my expertise definitely helps when we sit with the grant writers. So I'm not sure how other districts do it, but for 15 years, I've been the one, because I know McKinney-Vento so well, that I've been the one that writes like the core of the grant, and then the grant writers will help kind of put it in the template and kind of ask those questions they need answered. But we sit at the table and we share what students need. And sometimes, you know, we get pushback, and that's where we definitely have to be a voice for them and advocate for them on multiple platforms, you know, and especially when it comes to programs and direct service, because a lot of times the grant writers are far removed. You know, people at CO are far removed and they're not always in direct contact with the students and families. So that's how we've been successful in partnering with our grants department and other departments to get our spending approved. Via ARP, we hired Miss Janet and Paola as our social work and attendance team to help us find kids. We also hired 9 extended day and year social workers. So these people are working right now 6 hours a week, and they work in the evenings, like in the evenings after 4, finding kids, and they're in the community and partnering with community partners to locate kids, to identify them. So I wanted to share like a deeper look at what Paola and Ms. Janet do in their work, their outreach work. A lot of this work, most of it is done through the program, but this is different in that they do outreach, like they're out in the community, and I can let them share a little about where they have found kids, right? And it's amazing. The stories they share are so powerful. And I'm so thankful to them for their work. Do you ladies want to share now, or do you want me to go through this?
Sure.
Okay.
I know my colleague Miss Scott is on as well. So this has been an incredibly rewarding experience. You know, I'm a 25-year vet in the city school district, doing predominantly psychological counseling within the confinement of a school building. And someone got the crazy idea to let me out of the building. So I thought, this is fantastic. I go back to my roots. So, and I started in the community as a home-based social worker. So what Miss Scott and I did when we started is we had a conversation about how we were going to proceed in reaching out to families and children and what that would look like. And if we could reach families, what are the values and the practices and the ethics that we were going to bring to the continuity of care that we were going to provide? So we started by conducting a needs assessment of our community in the city of Rochester. And we took a pulse in connecting with places we thought we could find our families in transition. So we went and we talked to librarians. We went and we talked to our city rec personnel. We went to the transit center because often our families are in the actual transit center downtown looking to find a place to go. We went to hotels. We talked to different individuals in home-based preventative programs that were managing and working right on the front lines with families in transition. So after we kind of conceptualized, okay, now we have a team of people that could support us in identifying how do these agencies and respective partners and providers refer to us? And we thought it was going to be a challenging process, but it wasn't. They were so welcoming and wanting to share information with us and saying, hey, you know, a librarian, for example, would call us and say, we have a youth that's been coming to the library. I'm pretty sure they're supposed to be in school. Would you be able to come in real time, meet with the youth and see how we can triage that? And from there, our practice began. And then one referral turned into another, and then next thing you know, we're in the homes and we find a youth, and then, you know, we find another youth that had been missing from school for weeks and months and years. We found missing children from out of state. And we worked with the Center for Missing and Exploited Children. It just kind of took us in many different avenues. And I think it took the collective experience under the umbrella of Elizabeth's vision of how this program would look like, with Miss Scott's community practice as both an attendance expert and a community specialist, but also with her pastoral background. So it took us both on the front lines doing that work. And before you know it, our referral base grew. But the most enlightening part for us that we just rediscovered our community in a different way. And in doing so, it streamlined the process for our families. So families didn't have to necessarily reach out to the school and say that they were in transition. We would do that with them. and in the same at the same time that we identified them. And then we discovered not only are we having these families from out of state, but we can enroll them in school online to minimize those barriers and to get them, the families and with school age children into school quickly. So we were able to expedite the process. And at one point, I think we were farther ahead than our system could keep up. So we were kind of creating like little glitches in our system, but it was an incredible experience. And I think Ms. Scott can also share some of the experience being on the front lines with this work. So it's incredibly rewarding. And, I'm sad to be not part of this aspect moving forward, but it will always be a part of what I do. And I don't think I can ever go back to not knowing what I've learned in this experience. I take this with me, and I think it will enrich some of the tapestry of the work that we do in the city school district. So Ms. Scott, I guess that goes to you.
So I agree with my colleague, Ms. Machuca. We really enjoy this work. We really enjoy serving the families. We really enjoy serving the youth. And like she said, we found them in many different places, and we would meet them in different shelters and in libraries and places like that, and just get these kids re-engaged and, let them know, like Elizabeth said earlier, that at least they had one caring adult in their life that cared. They were sure when they felt like they had a caring adult in their life, they came to school. We re-engaged them, like she said. We got them registered for school. We took them food. Some of them were with their families. Some of them were unaccompanied youth. The ones that had families, we helped them as well. We found families that were sleeping in cars and abandoned buildings. These families were broken. Miss Machuca spoke to them on the mental health, and I spoke to them in a spiritual way. And some of them just fell in our arms and cried, and we just spoke to them, spoke over them, just spoke life into them, just helped them to want to live again. And this job is just so rewarding. I am just so sorry to see that it's coming to an end, because we get fulfillment in helping and serving these families and these children that come, if we find in our city, that are unaccompanied, that don't have one caring adult in their life that they feel like that cares for them. And a lot of times we were that person. They even still reach out to us and ask us for help, ask us for food. There's no way we can not. We have so many connections in the community now: food resources, clothing resources, shelter resources. We still help families. And I believe we'll still be doing that the rest of our lives because of this program.
Yeah.
I tell you, meeting with both of them weekly and hearing the stories and how powerful it is. And sometimes we would talk about how the smallest act of kindness can spark, right, resilience and hope in the kids.
Yeah.
It really is true. I think they do just need to know that there's someone there that's going to kind of walk them through this. And they did a great job at coaching them, not only walking them through and doing it, not doing it for them, doing it with them, the way Paola said, doing it with them and teaching them how to navigate, how to develop the skills they need to negotiate and to advocate for themselves. It's just really, really powerful. And I tell them I would tell them all the time, no pressure, but you are saving lives, because it really gets down to that.
It does.
That we're finding kids that really are disengaged. So a lot of us McKinney Vento liaisons, we get that referral, right? We get that referral from student placement, from schools, from the shelters, but we're talking about this outreach team found kids that hadn't been engaged in school for years sometimes, and it's not that they didn't want to go to school. It's just that sometimes every time they tried, something would get in the way, like at home or personally, or even navigating the district, like trying to register and things like that. They're like, I tried like 5 times, but they couldn't do it. And Paola and Miss Janet move mountains. Let me tell you, they have no problem, saying, hey, this is your student. They want to go back to school, talking to principals and having those conversations and pushing the limits, because, right, we have policy, we have procedures, we have processes that don't necessarily help. Not that they don't help, but that they don't jive with what our kids need. You know what I mean? They should be able to go back
Yeah.
to their last school. They should,
Yeah.
if they don't want to go
Yes.
back for safety reasons, then let's be flexible. Let's put them in another school, you know, anything to help them. And you all have done that, right? You have
Yeah.
fought departments to get the kids to school.
Yes.
We found ourselves in the most unique part of this work also involved, how do we get housing for families? We kind of tapped into a venue that isn't typically something that we would do in a traditional social work role, but because of the wraparound and the case management of it, we found ourselves negotiating landlord-tenant agreements. And saying to one of our shelters, hey, we located your family, we did such and such, we need to be able to house this family. And as it turned out, now we're to the point where our housing supervisors through the county, through Monroe County in the city of Rochester, are now referring to us. Now they're asking us for help, saying, hey, we have a family, how can you help them? So now what was an adversarial situation to some degree, because these are individuals that are evicting our families, became a collaboration of, I understand that this needs to happen, but we're going to advocate and we're going to make sure that our families are well cared for. And I think that became kind of the thrust of what we were doing. And that's kind of where we left off. And prior to Ms. Scott going back into a building, and I'm going back into a building in September. We'll see.
I know.
It's rewarding, incredible.
And I tell you, I think without these components, right, that we see here, I don't know that you can successfully and consistently promote attendance, regular attendance. Like you need all this. You need to go where the kids are, right? You need to be in front of them. You need to look at them. You need to see how they are. And you can't do that if you're in your office waiting for them to come to you. And a lot of people have asked agencies, shelter staff, other people in the community, like, how are you all doing this? Like, how are you finding these kids? Even principals and other people are like, oh my God, they're finding, where are they finding these kids? And you have to get out of the office.
Yes.
You gotta be
Yes.
where the kids are.
Yes,
right?
we hit the ground. We're in the streets. We're in the community. The people in the community, they know us. They call us. We're where they are. You have to be in the streets and in the community, and you can't be afraid. You got to be careful, but you have to go where the kids, you have to meet the families and the students where they are.
Yeah. And you both did this really well, the assessment piece. Like, what is there's many barriers, right? And there's trauma and there's losses and impacting them. But what is the one, like the predominant, the one that is, glaring, and that they absolutely, are they having a breakdown? I know Paola has been like, Elizabeth, I'm here with the police and they're doing a mental health arrest and she wants to decrease the harm to the student. And it's just amazing things that people don't talk about, or maybe are taboo, or maybe they're like, well, is that really, am I crossing the line by creating safety for this unaccompanied youth and ensuring that they are treated well and that the harm is reduced? I mean, the things that you all did were amazing, which led to the kid to be able to go to school. He got the mental health support he needed, the attention, even though it was a crisis, right? But he was taken in very gently and safely, and able to get the mental health attention he needed, or she needed. I can't remember what the student was, but able to go to school, and that's just powerful.
I think it was a collaboration too of community agencies, is because we were on the front lines together. We were able to triage together. So if one person handled one aspect of that intervention, then Ms. Scott and I could manage the on the spot mental health need at the moment, and then work on creating a support plan based on our intervention that the family and we would use re-engaging our youth back into school, because without having, and we did a soft handoff is what we called it, because often we identify our youth and the families in need, but we weren't walking them through that process. And sometimes our systems, and to be full transparency, our systems that we have in place in a bureaucracy can be very harmful without intending to. And I think making sure that our families received, that level of care and respect so that their dignity was restored. And we modeled what a collaboration looks like between a community and a family system intervening into the school. So, and after that happened, I think our youth began to attend school because they saw, okay, I have community support, I have school support, and I have my family and my caregiver with me on the front line saying, I believe you, I support you, and we're going to get through this. It was very powerful, incredibly powerful.
Yes.
Yeah. Yeah. And it can't be done without having someone at the school kind of to be able to pass the baton and say,
Yes.
okay, I'm going to check in. I'm gonna, communicate with you all and see if there are any other needs. And sometimes people are like, not it, but
No, we're like, you're it.
Yeah,
you're it, Tag, you're it.
Yep. And we need you, and just educating them and stressing the importance of why the kid really needs someone in the school to check in on them, especially if they're unaccompanied. And I love the wraparound. Oh, I'm sorry, Ana Sofia. Sorry.
No, I was going to say, Elizabeth, and everyone on the call, thank you so much for sharing that. I think this has been amazing already. And I know you have a couple more slides to go, but I did just want to address one question that was in the chat since we're already talking about this. But you all kind of alluded to kind of what your day looks like and kind of the importance of actually meeting students where they're at. But there was one question in particular about if you could describe your typical day, what would that look like?
Go ahead, Paola or Miss Janet.
Okay, so the typical outreach day would be, we would start out at a shelter. So in the same way that social workers in a building carry a caseload, if you're a social worker or counselor, we carried a caseload of shelters, libraries, and rec centers. So it was consistent check-in. It was that consistency and reaching out saying, we're here for you, you're here for us. We're going to work in tandem. And it was constantly keeping a schedule of that. So on Monday, we would visit the Center for Youth. So those are unaccompanied youth. And we would meet with housing case managers, and we would talk about identifying first the children that were in transition, what the needs were, and how we can navigate those youth back into their respective schools or through the transfer process. And then from there, it would be meeting a mom or a dad somewhere in a hotel and walking them through, this is what we can do in terms of our wraparound services. How can we support you? Is it tangible things like food and basic needs, or is it more than basic need? Is it, I'm having a mental health crisis. Can we connect you to one of our behavioral health specialists in the community? Or, and then from there, it would be, let's go, we would have to do a home visit. And from the home visit, it turned into the families in crisis. So let's access some resources within the community. Then it was, okay, we might have to reach out to CPS because we really want to let them know that the family is receptive to support. And maybe there's a misperception that the family is resistant or avoiding, and that's not the case. In fact, they just haven't been able to access the system in a way that was meaningful and supportive and restorative for them. So in bridging that communication and partnering with those systems, and it could turn into something like that. And then it was, let's access that resource in the northwest quadrant of our city that we know has food for a particular family. So the community of supports we established, we did that with the intention of knowing that we're going to be in the community and we need to access resources quickly. And those resources needed to come from agencies. So we had our resources in the northwest side of the city, on the southwest, on the east, so we could access them right in real time. And that made a big difference. And that created trust between us and the community agency and the families. And then they began to refer.
Yeah.
So,
I think what I loved, Paola, is that you learned from the community as well. You learned what was available to students, and you also learned where are the kids. Like librarians were like, they're here. We have a program for students, and they're here. They're at the rec or they're. So I think that's great, and you wouldn't know that if you didn't get out of the office. Like you would never know that.
No.
Yeah, so a typical day for us was very busy. but very rewarding. Yes. Yeah.
And
We didn't stop.
And I can tell you that these ladies, and I'm so blessed to have worked with both of you, they're not a 9 to 5 staff, because there were evening things. I know they work 10 hours, 12 hours, you know,
Yes.
not asking everyone to do that, but our kids sometimes, you know, you can't find them certain hours. You got to go
Yeah.
back and find them.
Yeah. Yeah. Because if they reached out in the evening time, then, you know, and I need food, how can you say no? You know, how can you say no that they need help? So we would sometimes do weekends and evenings. Yeah,
There's flexibility. We needed to be flexible, very flexible.
absolutely.
Yeah.
So the wraparound was looking at what other supports do they need? Once we did the assessment, re-engagement, how can we build, right, a village, a pueblo around our kids who desperately need support? Uh, we we've met with unaccompanied youth, and we've asked them, you know, how many of you have that one caring adult in your life? And you'd be surprised. Some do, maybe 50-50, but some don't have anyone. No mom, no dad, for whatever reason. They're 16 and they're on their own. So it's important to create that village around students and let them know that, you know, that people care about you. I think they need that accountability. You know, if you think about those of us that have children and they're 16, they still need that accountability. You know, they need that motivation, that incentive, even just someone asking and caring about them. So I think all of these components are really important. And I know it's a lot to ask. I know that most of us are spread thin, right? But if you ask me what has worked for us, because of I can't remember how many you all have found, but of the students, I think it's over 100, Paola, when I looked, over 120, 25 students, 20, 30, it grows daily. You know, at least 70% of those or more, are going to school consistently. These are kids that were not engaged in school at all. And I know that you all also, I think it's about 87% of the students you worked with their families as well. So not only the student, but the families. And I know that most, if not all, had 3 or more contacts. So it's not a one-shot deal always with kids. You know what I mean? It takes more than just a one-time meeting with them.
Yes. Yes, just agreeing with you. It's not a one shot or one time meeting. Sometimes we have to go back 3 and 4 and 5 times, you know. And they may reach out to us even 6 weeks after, you know. So we did do the wraparound service just to make sure that we leave the families and let them know they're still supported and we're still here for them. After we hand them off to the school, we can check in, you know, sometimes, but yeah.
We did check in. I think that was huge. And I think when we look back on when I was looking in our system of accountability, every contact we had with the youth was recorded on our own internal system of touching base with the family, whether it be a home visit or whatnot. And there's the average, I think it's a minimum of 12 visits, 12 actual contacts with our youth. That's how much it takes to get them to a point where they feel comfortable to begin to address the barriers that are preventing them from going to school. And then once we get through that and we're able to do the actual face-to-face re-engagement, and then it's an appointment with the school, an official appointment where people that are also could also potentially support the youth are present. So that way there is an actual plan in place. And when you have a plan, there's a level of accountability that's different than if it was just, okay, now you're going to go to school. Now we have a plan, and that plan has been documented. And then that documentation, it contracts for services, right? So now we're responsible. So, and it says, and to our youth, that's huge because I matter, I exist. I came here, someone reached out to me, and we've received that feedback from our youth.
Yeah, it's been such a blessing to have two people that solely do this work. Like we have a program social worker. So, well, I'll get to that slide. Like, how are we gonna, carry on this work without our social worker, without Paola and Miss Janet? But I can tell you it's very hard. Their dedication and their work and just being able to focus on this is amazing. It's like a dream come true. Like when they said, okay, there's money, what do you want to do with it? I knew what I wanted to do. I'm like, Paola, can you go to the fire department and can you go to the police department and can you go to the ER so we can find our kids? And Paola's like, yeah. So it was pretty amazing to have the money to be able to do, what you knew was the next step to find kids and get them to school.
Yeah.
Yeah. So one of the questions was like, what are the funding sources we have? In Rochester, we have the McKinney-Vento funding, and we also have Title I, which is the next slide. They're both similar. We use the money interchangeably because it's for staff, right? But on our McKinney-Vento, through our McKinney-Vento funding, we also have Camp Arise, which is a camp we have in the summer for our kiddos, and it's based mostly on SEL. There is some academic enrichment, and it's very much experiential. Because what I found was that during the school year, during vacation, during breaks in the summer, when I would talk to the shelter supervisors, they said they just sit in the shelter. Like there's nothing to do, at least in Rochester. I'm not sure what other shelters do. So that's how the camp came around. And all the other stuff we do day to day. The ladies do this work also. The difference is that, again, we get the referrals, and these ladies went out and found the kids. Like the kids are already identified when the referral comes to us. But in their case, as the outreach team, they went out and found the kids. So we do a lot of stuff. Student and family counseling, a lot of collaboration. I mean, you really need to know the community you serve, and you need to know what's out there. And I've been working on an asset map, and what that is, it lists the resources in the community and what they can assist with. What are the assets? And it's an actual live map. It's a Google map where I'm hoping we can text to families or email it to them so that they can see where they're at, where they're temporarily housed or permanently housed, or people that are new to the area, relocated, or our immigrant and refugee families can click on a tab and find out where's the food, where's the clothing, where's the, where can I find temporary shelter and things like that, the rec and different things like that. I think they need a visual. We give them a community resource guide, but it's so different than seeing where you're located and where these places are. I think that's amazing. I'm really excited about that. So sustainability beyond art. I just want to cry. I want to keep Paola, Miss Janet. That's what I want. But, I'm thinking if there was any way to maybe, if we could get more money in Title or split the person between Title and McKinney-Vento, that's something that our budget season is, I think our budget book is almost about to come out, so I don't know. But I'm hopeful that maybe I can advocate for that. Also, we've discussed maybe picking one day a week or bi-weekly where myself, the social worker, can go out and do this work. I don't know that we'll be able to replicate it because they're so dynamic and amazing, but we'll try. And then also utilizing interns, right, to train them and walk them through this. And I know Paola did some of that
Mhm.
work with our interns that are in the program. Did you want to share a little bit on that, or?
Sure. I think right now, so Miss Scott and I, when we began to kind of introduce some of our interns to the work and the process that was associated with doing the outreach. So we kind of triaged with them as well. So we would take one, not both, because sometimes that can be overwhelming for families. So they were able to, and they were really just kind of go-getters. And once they caught on to some of the process and the procedures and how we did intake and that, we allowed our service to be directed by the needs of the families. Our youth were a little bit different just because we felt a sense of urgency of re-engaging them with school. And when we weren't able to re-engage them, we actually connected them through things like Job Corps as alternatives, or alternative instructional programming through a GED process, or something that was still education based, and it would allow them to continue. So I think the students played a vital role, because I think they brought in a lot of information that was relevant and current when it comes to research. And then Miss Scott and I kind of took a look at some of that information, and we looked at, and as well as Elizabeth, some of the things that we could do as a pre and post moving forward, how we can assess where a student is when they begin intervention versus and when they transition out. So I think this is something that could really evolve and turn into something that is incredibly therapeutic, especially when you're talking about how to re-engage youth and how to assist during transition. Like, there's so many things you could do with this, but I do believe that our youth are particularly involved and see our librarians as such a huge asset. And I always wonder what that would look like as kind of a thought if McKinney-Vento was associated somehow to libraries. I don't know why, but it seems like that's a natural place for families and youth in transition. That's where you go. So why not have the services there? So I don't know.
That's amazing. It's a safe space.
Yeah, it's the same. It is a safe space.
Yes, I agree. It is a safe space.
And students love it. All aspects of student, whether you're in college, you're an
Yes.
intern,
Yes.
you're
They
a
would hang
forever
out
learner.
there.
Yes.
We just need to get Food Link over there, like a food truck, so they can eat and go to the library.
Well, you know what we do? We have a community that our downtown library has. It's called the community meal. So it's run by Food Link, and then our families in transition, they pay maybe $2 to $3, and they get a full meal while they're at the library. So it's a nice way to give back to the community.
Are you kidding me?
No,
That's
it exists. It's in the.
amazing.
I know, isn't that great? It's wonderful. It's beautiful.
It's awesome. Yeah.
When we enroll families from out of state when they're in transition, we meet with the families at the community restaurant, and we actually have a cup of tea or coffee, and we provide them with a meal while we're doing the online registration for school. So
Awesome.
Yes.
Yeah.
Good stuff. So the last slide is just our contact information. Miss Janet, actually, there have been some shifts, knowing that these two positions are going to be cut. Unfortunately, she had to leave because there was a position available that may not have been available had she waited. So I thank Miss Janet so much. It was really hard letting her go. And then I know Paola too is waiting to see where she'll end up next year.
Yeah, it was really hard leaving because this program is so wonderful, and helping our students and our families. Just hate to see it, coming to an end. It's so needed. Even people in the community were like, what are they going to do when you guys leave? You can't leave. They need more of you. Can they clone you and make more of you? Because this is such good work. So it was very hard leaving, and I would absolutely love to come back.
Awesome. Thank you, ladies.
Thanks.
Thank you all so much. I know we're close to the hour, so I just want to address any additional questions that came in. One that came in specifically for you, Paola, was around the 12-point contact. So how did you all figure that out? So if you could say a little bit more about that, we'd love to hear.
So that came as a direct result when we went back. So we documented, Ms. Scott and I documented all our contacts, not only in our Power School, but also in Excel, in our Excel system. And each contact was it related to school? Was it a crisis call? Did it have to do with re-engagement? So when we went back and reported that information to Elizabeth in a format for data collection, combining not only the data that we had plus what we entered in our own database district-wide, it seemed like we had a more, it was when we physically counted, it looked like we were averaging like between 11 to 12 contacts with our youth before we could actually get them re-engaged, because we would first find them, then we would contact, can we meet you here? Then let's stabilize. Then it's okay, now we're meeting you here. What do you see your school look? What does your school day look like? What are some things that you're going to need? So then it became, let's provide some basic needs. Let's now let your family know that we recognize you're in another state, but they need to know that you're safe. And then it's, let's connect you to community agencies that might support this transition as you go back to school. So those are 2 or 3 more contacts. And then it's okay, now let's set up the appointment to get you back in school. But before we do that, let's script how this appointment might go so that you're ready to answer, so that you're ready to answer when someone says, well, why haven't you been in school? So that you feel comfortable explaining if you felt you needed to explain, and what the school can do differently to keep you engaged and what those supports would look like. And then from there it became, let's draft a plan so that we could hand off to the school with a snapshot of the student and that moment in time of what they may need moving forward. So, and by the time we got done, it was literally maybe 12, even more. In some instances, it was more than that. So, but our youth were a lot of work, and that's where a lot of our focus was, is making sure our youth were off the streets and in school, just because of the nature of some of the things happening and the level of violence in Rochester. We felt a sense of urgency. So that was that was a huge focus for us. And what Ms. Scott didn't share is that because of her affiliation in another role, sorry, Ms. Scott, in the community, there was direct access to tapping into some of those students that were impacted by violence as well. So it was
Yes.
it was very impactful. So that's where the 12 comes from. It seems like it took, the meet and greet, let's build a
Yes.
relationship. Let's talk about what you need. Let's look at what the
Yes.
plan looks like. Let's set up the meeting for re-engagement, and let's look at what aftercare looks like and follow up.
Yes.
So that's kind of where it came. And sometimes our practice is ahead of our theory. You kind of, in this particular role, it takes everything we have and all our skills come to the table, because your day can go in any direction. So
Yes, and even when Miss Machuca said the needs, when the kids tell us, they need clothes, I need clothes. Kids want to go to school with clothes, nice clothes. And so that's when we would refer to our fit department, and get them book bags and school supplies and school clothes so that they can go to school, because a lot of them did not have school clothes to go appropriate to go for school, or shoes or sneakers. We got all of that stuff from them.
Thank you both so much. I want to say in a previous role, I worked with shelter providers and supported them in kind of chronic absenteeism work. And the piece that you touched about like documenting how many times are you following up with families, what is the plan, was such a big game changer. So I'm really glad that you touched on that. Thank you so much.
You're welcome.
And I think the one other question that maybe I will pose back, and this comes similarly, I think for me, is really touched my core of a little bit of the work that I did previously, but what would you say? I know that there's a lot of liaisons and other folks who work with families who say, there are some parents who might not place in as much support into chronic absenteeism, or what would you say about folks who say that, some parents are just not as interested? How have you addressed some of those mindset changes?
Ooh, we encountered that in schools a lot. So what we explain when we start off meetings too, especially with school personnel, is that Ms. Scott and I are pretty good about, feel comfortable saying to the people that are coming to the table as part of that support system in school or in the community, is that we come from a place of no judgment and no harm. We're assuming the best of intentions, and we're here to collaborate moving forward. What is behind us is something that we can look for so that we can prevent and work through barriers and obstacles, but at the same time, we're moving forward, and we understand that people go through things, and trying to explain that to a school system, which is based on a punishment model, sometimes it's very difficult. I can honestly share with you that the families, and I think Ms. Scott could attest to this, I think we encountered a relief and a welcome, because
Yes,
what happened was we met people where they were, not with the expectation of coming to our office,
right.
where there's, that experience for some of our families and our children have been not necessarily positive as well. So our families carry that trauma. My school experience wasn't necessarily positive. My experience with community providers wasn't positive, and we weren't willing to entertain that. We were saying we understand and acknowledge and support and respect and honor where you've been, but we're not going to come from any place of harm. We're going to do with you and support until you say that we've done enough. And that's kind of how we contracted, and it stayed that way, and continues, even though I'm solo.
It's challenging their thinking, right? And re-educating, the school community on
Yeah.
our kids, on our students in transition, and our families that, that's a stereotype that when you talk to the parents, you realize that, man, they're hanging on by a thread. And it's not that they don't care about their kids and that they don't want to be part of their education. We need to find creative ways to keep them informed.
Yep.
Right.
Thank
And
you all so
sometimes
much. I'm sorry, Ms. Jones, you can finish your thought.
no. I was just going to say, and sometimes when families are traumatized, when they've gone through a lot of trauma and the things that go on in the community, and their things are going on at home and with the kids, that they're not thinking about school. And so that's where we come in to help them with those, like you said in the beginning, with those basic needs, to help them to get re-engaged and to get the mom and dad or whoever's in the house, to understand that the importance of getting the kids back to school. Because it's not that they don't want them to go to school, it's just a lot going on, a lot going on in our community, in our city. And so our job is to help them to get back re-engaged, and so we do that.
Thank you both so much. I know we are at the hour here, so I think we have to wrap up our time, but I just want to reiterate that there have been so many comments in the chat just saying thank you for all that you're doing. And I have to say, it's just moving to hear how passionate you are about the roles that you do, even knowing that there's a funding cliff. But I think the lessons that you all have given Rochester and the rest of everyone on this call today will just be so long lasting. And I hope you're so proud of yourself for what you've done. And I just want to drop really quickly the link to our Slack community. I know we're at time, so I won't share any additional slides, but just want to remind everyone that we do have our Slack community open. So if you do want any more advice about anything, please feel free to sign up and ask any questions. And thank you all so much again. I really so thankful you could be here with us today.